Place the defib between the patient's legs. To access the chest, you're going to have to remove clothes either by using the zips, or if you have tough cut scissors, you can cut the clothing off. That will also displace an underwire bra if needed. During cardiac arrest, patients are often very sweaty and may also have vomited. So you'll have to prepare the patient's chest by wiping away extra secretions and moisture using whatever you have available, towels, cloths, or the patient's clothing. Standard pad placement is underneath the right collarbone and underneath the left armpit. However, before placing the pads, you should consider other issues regarding the chest, which may involve removing medicine patches if you see anything obvious on the chest wall, displacing jewellery, flicking it to the side. If you notice a patient has dermal studs, this will be impossible to remove during cardiac arrest, and so avoid placing the pads directly on top of the studs if possible. Implantable cardiac devices are usually implanted underneath the left collarbone, but for some reasons they can be implanted underneath the right collarbone. This will be identifiable by a raised bump and a small scar. In these cases, you wouldn't want to place the pads directly on top of any cardiac device. Consideration would therefore allow you to place the pads in a biaxillary pad placement underneath the left and the right armpit. In patients with excess hair, you would consider either shaving them, but during cardiac arrest this can often be very tricky, and so consideration again of a biaxillary pad placement may be optimal and allow better pad to skin contact. Opening up the pads and following the instructions with the diagrams on the pads will give you additional support and help in pad placement. Removing the pads one at a time in order for them not to stick together, and then using a roll motion which will eliminate any air pockets underneath the pad and allowing good pad to skin contact. In large breasted victims, you may have to displace the breast in order to get the pad in the correct position underneath the left armpit. If, however, you notice after placing the pads that your picture diagram doesn't represent your exact placement, it may be upside down or back to front, leave the pads where they are, they will still work. And turn on the defib and follow the prompts. Meanwhile, continuous chest compressions will be ongoing throughout this. Switch on the defib and follow its prompts.
Adult pads. Don't touch patient. Analyzing.
Don't touch patient, everyone's clear.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button.
Oxygen off, everyone's
Don't
clear.
touch patient. Press flashing shock
Shock delivered.
delivered. Start CPR.
And switch your oxygen back on now.